You're tuned to Radio Kidnappers, the voice of Hawke's Bay. This is the Acupuncture on Air program. Our pleasure, as always, to have in the hot seat Heiko from the Acupuncture Clinic in Hastings. How you going, Heiko?
I'm very good, and I was not only just in Hastings, but recently I was at the Acupuncture Clinic in Queensland as well.
Queensland, yeah. What was it like over there?
Oh, it was fantastic. And apparently it's already, they're getting a heat wave or something over there, so they say we don't know how hot it's going to be in December, but already now it was well over the norm.
We think we get hot here, but they really get hot over there.
Yeah, I know.
You know?
Yeah.
And you look at the weather map and you think, well, probably 80% of it's like a desert. You know, I mean, you say who want to live there, but people love it.
Yeah, and I'm just amazed. It's just so busy now that the government. I was there maybe 10 years ago, but now like that motorway that goes, I think, from Byron Bay or something right up to Brisbane, it's just chock-a-block all the time.
All the time, yeah. And you sort of got to be. I think you probably got to be a local to drive up there and not be afraid.
Yeah,
because that traffic just doesn't stop, does it? No. It just keeps going.
I mean, we even were driving back one night and it was like 11 o'clock and it was still busy.
Yeah.
Right? And you think, geez.
Yeah, that's right. Anyway, you didn't get a chance to go and get some black licorice.
No, I'm sorry about that.
Told you about that.
But you know, those lollies out in the waiting room they're great. So just
that's
a couple of bonus points there for your management to keep them.
But you have got to suck them, because if you try and chew
them, yeah, I know that.
Pull your fillings out.
Yeah.
Anyway, what are we going to talk about today?
Well, we're going to talk about something that's maybe a little bit embarrassing for some people, but urinary incontinence, and it's actually much more common than what we think. I'm
pleased to say I've never suffered from it, but yeah, it must be, it would be embarrassing, and I always thought it happened to maybe pregnant women and old people, but not the case.
That's, I guess, is the more of them. I don't remember, we've still got the young kids that get it as well, and sometimes I'll see it's more so boys. I don't know why, if it's just me or whether it's even up to 10 and 12 years old, which can be particularly embarrassing for them, because then they don't want to do any what do you call it, like sleepovers at friends' places and things like that, or have their friends over, because it's embarrassing. And so it's quite a problem.
Now, I know that you're going to say that acupuncture can help with it, because acupuncture can help with anything.
It treats everything.
Yeah, but it can't wind back the clock as far as old age goes. But I wonder what causes it.
And there's a number of causes in Chinese medicine, and the more common one, if you like, it stems from the kidney. I mean, the problem, of course, is in the bladder and the genitals per se. But then Chinese medicine says, well, that the bladder and the genital that connects to the kidneys. Yeah. And then we say if the kidneys are weak, then they can't hold on to the water. And as the body ages, the heart gets older, the liver gets older, the kidneys get older, the skin gets older and all that. So then if there's some kind of constitutional imbalance tendency, then the kidneys can get weak. Or if the patient has had over their lifetime have done certain things that have weakened the kidneys, then it doesn't hold on. And that's why, you'll meet some people, they might be just a round figure, say 65, and they sleep right through the night, they never have a problem. But then you get someone else that's 55, and then they're already getting up at night 3 times a night to go to the toilet. And that's partly, they're constitutionally, their kidneys are a bit weak, or they've done things that have damaged the kidneys. And then if it's a more serious problem, then it's the incontinence. Yeah. Where it dribbles out, or they just can't get to the toilet in time. And again, it is a common thing after pregnancy with many women. Again, the culprit there is often the birth itself has weakened the kidney energy. In the past, I have mentioned in the shows how the kidneys play a major role in the whole of the reproductive and the hormonal cycle. So how do you start treating it? Well, then again, you should know. What would I be treating? I've just told you it's the kidneys. So then
that's the kidney. So the kidney. So I guess you'll either use the needle or you'll use Moxa.
Yeah, we'll use both.
Moxa.
Yeah. So again, kidney points. If the cause of the incontinence is coming from the kidneys, where the kidney meridian runs up inside the leg, there's certain points that we use there. But again, the Moxibustion, very important. Because the moxa itself is warming. It's because we sort of say as the kidneys get weaker, they can get cold. We say the kidneys loathe the cold. And maybe you've experienced it, but you've heard people say, geez, that the weather suddenly turned cold You know, you're just sort of getting from the end of autumn, and then suddenly, bang, you get that cold thing. And then people say, yeah, I've been running the toilet like 6 times today, you know, because it takes a bit of time for the body to adjust. And this sort of demonstrates how the kidneys are quite vulnerable to cold.
I've been thinking about that. I mean, we've talked about this many times, hot and cold, yin and yang, and that sort of stuff. But isn't your body a bit like a thermostatically controlled unit? I mean, our blood temperature is about 98 degrees, and it's always 98 degrees when we take our temperature. So inside our body, aren't our kidneys and our liver and all the other organs, aren't they always at the right temperature? So how do they become hot and cold from a Chinese perspective?
Well, I think it's just because the body is vulnerable. And I mean, it's just like the example that I always use is that the railway tracks from Sydney to Melbourne, I forget the figure, but it's 2,000 kilometres or something. But they can vary as much, 7 kilometres a day in length, with the expansion and the shrinking of, depending on the weather, whether it's cold. And the human body is also very, very vulnerable to changes of the weather. Particularly, I see it a lot, and it's quite straightforward. I have people that work here in the freezer works at the various places around Hawke's Bay, and they're prone to all these, we say, cold diseases. One of them is the kidney. Even though they're dressed warm, but it's still it has quite a contracting or freezing effect on their body. Their core body temperature might still be healthy, but sort of the outside of the body, it does suffer from the coldness.
Okay, so even though it's a bladder issue, are kidneys always a problem?
No, again, that's the more common one. There are a number of others, and one of them is a more general term that we call it damp and heat. And it literally is sort of like it portrays that self in the natural thing. Think of it like a compost thing. It can come from irregular diet, particularly too much sweet and greasy food, and then and people will say, oh, if I eat too much of that, I feel really gluggy and bloated and tired and thing. And we say this damp actually then, like a swamp, it settles down, and then it sits there in the intestines, and then you add more damp and greasy sweet type foods, and it sits on top, and then it keeps creating this compost heap, and that then burns down, affects the bladder, and so then we have a damp and heat condition. So then, of course, with this particular case, we would likely not use Moxa, but we would be using treatment to clear away the damp and heat, and so certain acupuncture points might have a diuretic effect. So you're actually doing that to get rid of the damp, and then that then stops that sort of dribbling urination or that inability to hold on to urination.
If I was going to a real doctor, what would a real doctor prescribe?
Yeah, well, so there are a number of drugs that they use, and probably one of the most common one is I think it's called Moxibustion, and it has a number of quite unwanted side effects, and people sort of put up with them. And I've had patients sometimes where they've come for something, and I've written down all the drugs what they have, and then I'll say, oh, how long you been on this one? They go, oh, 3 years, and then they go, I don't even know why I'm on it. What's it for? I said, well, it's for like urination problems. And I said, oh, and I said, has it helped? And he said, well, I don't think so. And then they have a whole bunch of other different symptoms that I think that the drug itself has caused. Another one is what they do. They actually inject some kind of synthetic filler into the sort of bladder itself to fill it up, so that the water won't leak out. So
like Botox.
And Botox is another one. I don't exactly know how the Botox would work there, but I mean, I think it must tighten up things. But I can't imagine that they would be, from my point of view, highly desirable as a form of treatment.
You've got another one here, which is electrical stimulation to the genitals. That doesn't sound very good to me.
Yeah, and this supposedly sort of does something too. And again, they need a number of these treatments over many months. I can't sort of quote how successful it is, but I'm sure it's not very high on the likeable type of treatments out there.
Yes. So, how common is it?
Well, I think it's. I mean, I can't sort of say, it's 10% of all the patients that I've ever seen, but it's very common, and it's one of these. I guess it's a symptom that not many people openly talk about at the barbecue or at the dinner party at night. So yeah, as I said, I couldn't say, but I mean, I do see a lot of patients with it, and often they've come for something else, and then when I've been doing my sort of case history notes and the diagnosis, and then they might say, oh yeah, I've got that,
Sure. Okay, so if I had traditional or Western medicine, am I likely to be helped overnight? And how does that compare to what you're going to do for me? How quickly would it kick in?
Again, I think for this particular type of condition, I don't think any of them help overnight.
Yeah.
And usually, like a problem like this has been a long time coming, or it's had something, I won't say serious, but you've just gone through a pregnancy and birth and blood loss and energy loss and all that. So you've lost your reserve, so you can't sort of expect to just switch that back, in a couple of days or whatever. So yeah, it's. I mean, I have to say, you probably would want to try treatment like for a few months, but I'm looking even at some of these the Western medical ones, even the electrotherapy one that takes months. So and I don't know how effective or how desirable it is.
Okay, so we come and see you. You basically got 3 treatments. You got the needle, you got the moxa. What about herbs?
And the herbs definitely too. And again, if you think about, as I said, that cause of the kidneys being cold, we have certain herbs that are like warming. And like one of them, for example, is a cinnamon bark. Yeah. It's a cinnamon that you can buy in your supermarket there that you use as a spice for your cooking. We use that. But again, it's used in combination with other herbs. We say to warm the kidney yang. So it might be mixed with dried ginger and licorice and some other herbs we say to tonify and to warm the kidney, and that then holds the urination.
We normally think, I suppose, well, I think anyway.
You do think sometimes, do you?
Yes, sometimes. I've been known to. My wife keeps asking me to start thinking about doing stuff around the place. But I would normally think that this happens to women. But does it? Obviously it happens to men, but what's the percentage? Is it more men, more women, 50-50 or what?
It tends to affect women with pregnancy and with more women than men. But with elderly people, I think it's even it's 50-50. I can't sort of say that it's more men or it's more women. I think it's just the nature of that person and their constitution and their lifestyle that they've had over the years.
I think if someone said to me, okay, well look, you've got a problem with incontinence, urinary incontinence, and we're going to give you electroshock therapy to your genitals, I might want to be thinking about having some acupuncture.
And that's why I think a show like this is good, because it does open up to give people an option to think about, because often people, just because of the general marketing, I guess, of acupuncture out there, it's just sort of known, it's for pain.
Yeah.
If you have pain somewhere, it can help for the pain. But as you know with this show, acupuncture treats everything.
That's amazing. It does treat everything. Well, we're just about out of time. Before we get to our song, just remind our listeners where you are. How do we get hold of some of this acupuncture or moxa?
Yeah, well, I think the best way is to go to my website, which is acu123.co.nz, and I'm practicing here in Hastings, and the numbers and everything is on there. And to finish the show, I've got a song that I no doubt that you probably just played it every day. It's a song by Ruella, and which we have had on the show before, and the song is called Live Like Legends.
Well, probably like I said to you the last time we played Ruella, I mean, who's heard of her? I mean, she's probably very, very famous, but she's only 32 years old. She's just a kid.
I've just read, because I'm up to date and everything, what she's doing, of course. She's just in the process of finishing her first album, because she has tended to do like more music for TV shows and movies and things like that.
She has
got her own sort of full album coming out.
She's got a lovely voice.
Yeah, she's fantastic.
Her real name, by the way, is Maggie Eckford.
Yeah, and she does. Yeah. She has like a dual personality. She has a country and western side to her, and then she has the Ruella side to her.
She's 32 years old. This song is out of 2016. She's been doing it since 2010, and no doubt she'll be doing it in about 30 or 40 years' time as well.
Yep.
Long when we're possibly no longer around.
Oh no, with acupuncture, it treats everything. We can be here in 60 years' time, Ken.
Good on you, Heiko. As always, a pleasure to talk to you. Same time, same place next time.
Okay, cheers.